to my life, and today I just want to share um a little tip on dieting with breast cancer. Ways to stay healthy. Ways to stay healthy. So we're going to talk about healthy tips on how to stay healthy or to prevent breast cancer. I mean, you won't prevent breast cancer completely, but I mean, most times it's a lifestyle. Um, and I will be discussing that today. As you know, I am a big advocate for women who are fighting cancer, breast cancer specifically. I mean, I know cancer is cancer, but my area of interest and education is really with breast cancer because I am a survivor. And I am on my YouTube as well. So if you see me looking here and looking there, then it's because I am on two platforms. So uh, several lifestyle choices and medical considerations can help reduce the risk of breast cancer. And some lifestyle factors are like, maintaining a healthy weight. For me, I've gained a lot of weight, and to tell you, if I tell you that I'm not worried, then I wouldn't be speaking the truth. But we're trying to figure out what's causing my weight gain. I did a test, a thyroid test, because thyroid can cause weight gain. I'm also on bone treatments. I'm on bone treatments as well, zoltronic acid. I'm not sure how long, but I've been on it for about 3 years now to strengthen my bones because I'm at risk for bone disease as well. And so sorry, people on YouTube. I'm looking at the TikTok. I need to get myself a next tripod. Yeah, so I've been on bone treatment, and I just did my surgery, my next mastectomy, 3 weeks ago. Yesterday was 3 weeks. I still have the scars are still, still healing up, but they're healing up nicely. But yeah, so one of the ways are being overweight or obese, especially after menopause, increases risk of breast cancer. Well, I am in menopause and I've been in menopause from the age of 30, really 30, 31. When I just turned 31, maybe about 2 weeks after my 31st birthday, I've been in menopause. Um, and I do get all the menopausal symptoms, hot flashes. Up to this evening, I was so cranky. I was quite miserable. But yeah, so I have all the symptoms of menopause. I went into early menopause, and it's getting to know my body all over again. So it's the aim for a healthy body mass index, engage in regular physical activity. Am I physical? Not really. I'm very busy, but I don't have a routine exercise that I do. I sometimes I do workouts, I mean in my bathroom. I'm not committed to going to the gym, right? And so I work out in my bathroom. Like I'll do some squats, and I'll do a couple, movements with my hands just to stretch them a bit. Because honestly, it's very important. Put the joke aside. It's very important to do your exercise. And so, regular exercise can help to maintain a healthy weight and reduce your risk of cancer. Aim for at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week. No, how many of us can manage that? Well, not me, definitely. But I mean, if you can do it, then fine. I'm always feeling tired. I'm always fatigued. I think it has to do with menopause. I'm always fatigued. So yeah, I don't think I can manage that vigorous aerobic activity. That's not me. So it's very important to listen when you hear about these conversations, because you never know when you'll need the information or to share it with someone, or to just to save lives. And my main focus here is to spread awareness. And so limit limit alcohol consumption. Well, yeah, I'm a survivor. I don't drink. Never drink alcohol even before my diagnosis. Never did. And so I don't know when they say limit alcohol, but I wasn't a person who consumed alcohol beverages. But alcohol increases risk of breast cancer, even in small amounts. Interesting. If you drink alcohol, do so in moderation. No more than one drink per day for women. Now, some of us drink non-stop, right? Yeah, we have to limit that. You don't want to get the amount of scars that I have. I mean, as I say, I wasn't a drinker, but at least, if you can, whatever risk reduction you can take to maintain a healthy diet, then just focus on that. Um, yeah, I have multiple scars, and sometimes it's frightening. Sometimes I'm like, wow, I went through all of this. Yeah. So alcohol increases the risk of breast cancer. We went through that. Eat a healthy diet. Do I eat healthy? No. Well, I'm not gonna say no. I do. I have a moderate diet. I do vegan, vegetarian. I do eat my meat sometimes. I eat like I do eat chicken. I eat chicken, and I eat a little chicken. I eat fish, shrimp. Well, the shrimp is not really a big thing for me, but I'll have the shrimp once in a while, like maybe once every 4 months, thereabouts. I used to be a shrimp lover, but not anymore. And so I do my mostly fish like on a Friday. I'll definitely have fish on a Friday. So I look forward to my Fridays so that I can have like a steamed fish or roast fish or whatever it is. But I'll do fish on a Friday, mostly steamed fish though. Um, yeah, so the next thing is that, focus on diet rich in fruits, vegetables, and whole grains. In the mornings, I have my tea first. No, I have my tea with no sugar. I'll do ginger and mint tea and no sugar added. And then I'll go on to my fruits. So, you can't really do fruits like all the sweet fruits because that's still a lot of sugar. So, I'll do like two fruits in the morning, like a melon and grapes, or sometimes melon and cantaloupe. And then I'll squeeze my fresh orange juices, of course. I'll squeeze my oranges, definitely. That's a vitamin C, because I used to take my vitamins, but what is happening, I realize that my tummy gets really swollen when I do the vitamins. So I try to source it naturally. Like as I say, I juice the oranges. So that's what I'm doing now, and I'll eat up my fruits and veggies. Limit processed food. So I was a big lover of sausages, and whenever I eat the sausages and stuff, I would feel really sick, like cold sweat before the diagnosis, like a couple months leading up to the diagnosis. I would get really hot, sweaty, my chest would burn, I would have palpitations. When I eat the sausages, I used to melt the cheese on it, eat it with bread and tea. But processed food, it's definitely not good. You don't want to have processed foods. Stay away from that as much as possible. Soy, no soy. I mean, women should not do soy. Soy is not good. It's added hormones, it's estrogen, right? And the cancer, my breast cancer was, and I don't really want to own up to it, but the breast cancer that I had was estrogen positive breast cancer. And it was driven by my hormones, which is estrogen. So I don't do soy. The doctor said to stay away from soy. So I don't do soy. Um, so don't smoke. No smoke. I don't smoke. Never did smoke. Smoking is linked to an increased risk of various cancer, including breast cancer. So no smoking, right? No smoking. Breastfeeding if possible. I did not. My daughter, I didn't have enough milk to breastfeed, and I didn't like the pulling on my breast either. My nipple, it hurted so badly. It pained. My daughter would bite on it and then look at me, and I would scream like, I cannot do this. So when I didn't have any milk, I was happy, but she was premature. She born like about 6 months, 6 months thereabout, and she was premature, and so of course she needed the milk, but I could not manage to breastfeed her. It was too much. It was hot. And then I was in, what's the thing called after pregnancy, not mental illness, postpartum depression. Yes, I went into postpartum depression, but thank God I got over that. That's a whole different story, and that's why I know I'm a strong person. I'm a strong woman, and I will share postpartum depression another time. It's very important to learn about postpartum depression, but we'll talk about that some other time. Medical considerations like hormone therapy, limit or avoid hormone replacement therapy for menopause, as it can increase the risk of breast cancer. So even when I pretty Yelly, hi. So even when you have even those hormone pills that you're taking, they're not good. Anything with hormones, definitely not good. You want to stay away from those things. So that's a no-no. No hormone therapy, nothing like that. All those overnight pills and stuff. I don't remember birth control pills. You want to stay away from those things. Discuss the risk and benefits of oral contraceptive with your doctor, especially if you have other risk factors like genetics. So if it's in your genes, you want to stay away from any contraceptive, right? And you want to follow everything. And you want to follow everything that I'm saying, because it's very important if you want to reduce your risk of getting breast cancer. So you can do, there are testing to see if you have the genes for breast cancer and other cancers as well. It's called the BRCA genes. It's done by saliva. I think it's 500 US to do it. So you can try that as well. Just so you can really reduce your risk of getting any cancer, breast cancer. And then you would stay on top of your game in terms of testing as well, and doing your own self-check. Yeah, you would definitely stay on top of your games. So medication for women at high risk, medications like tamoxifen or raloxifene may be prescribed to reduce the risk. Well, I didn't know. Well, yeah, once you're being diagnosed, then you get these risk reduction medication. Well, I was on tamoxifen, but my doctor said that it was too weak. My oncologist, she said I needed something stronger. So I'm now on anastrozole, which reduces the risk of breast cancer in terms of if there's a potential tumor trying to pop out, then it will shrink it. So yeah, it will stop it from growing. So I am on anastrozole, and I take that every night, and that is for 10 years. I'm 4 years into it. So when you don't have the BRCA gene, what does that mean? So if you don't test positive for the BRCA gene, then your chance of getting breast cancer or certain cancers are very low, especially with your siblings as well, because that test is also, shows within the family line, like your siblings, if they'll get the cancer or not. But so if you test negative, then that's a good sign. I tested negative, but I had breast cancer, right? So it's not genetics, which is good. So I don't have to really worry about my daughter getting breast cancer. I guess it was just a lifestyle for me, since I tested negative. So it's really lifestyle, which is why dieting is important. And yeah, so dieting is very important. So even if you test negative, dieting is very important. So for me, I guess it was a lifestyle because I didn't eat fruits, vegetables, nothing like that. And so for me, I think it's lifestyle. So remember to do regular screenings like your mammograms and clinical breast exams are crucial for early detection, which improve treatment outcomes, right? I I do my regular breast self exams. So now I no longer do mammograms because, as I say, I did the surgeries 3 weeks ago with the breast, and so I now have 2 silicone breasts, so I don't need to do mammograms anymore. But I think they will do ultrasound, of course, but make sure that you do your mammograms and ultrasound. Make sure that you do your own self-examination. Rub here, feel your neck, feel up in here for any lumps, any anything at all, any little sign. Then you go to the doctor. It's very important that you go to the doctor, examine yourself properly. Early detection is the key. Early detection saves lives. Early detection saves lives. If you know how much I'm happy to be here today, I'm so grateful to be here today. So early detection saves lives. And another important note, it's essential to consult with your doctor or healthcare provider for personalized advice and to discuss your individual risk factors. They can provide guidance on the most appropriate preventative measures for you. While these steps can lower your risk, they do not guarantee that breast cancer will not occur. So that's my information for today. That's Hi. Thank you. Some on YouTube as well. Hi, Martina Brown. How are you? Smile Queen. Hello. And then we have G. Have a blessed day. Remember, God loves you. Thank you so much. I really appreciate all the comments. Thank you. Yeah. Do you have any question for me? But that's all the information I have today. I will come back again tomorrow with more information. Or if you have any questions that you want to ask or anything you'd like to discuss, then that's fine. You can let me know as well. And I thank you guys for watching this little session. So if you have any questions, or if you know anyone who is going through breast cancer, I'm here to support anyone. I am here for you guys. Thank you for the info. You're most welcome, Martina. You're most welcome. Definitely. Yes, very important, Nicole, on TikTok, that we watch the products that we use as well. Very, very important. I'm like, man, I miss all my Bath and Body Works, all my stuff like that. So I now go to Earth Elements to get some natural products. That's what I'm doing now. I get body butter, and I still watch the ingredients that they use because I am very much afraid of soy. I'm afraid of soy. So we really have to watch the products that we use. So before, even with my deodorant, I used to use a lot and rub it under the arm, right? But now I stopped using it, but then being in menopause and stuff, I feel like I still need to use it because I feel like I still need to use it. because I feel like I get sweaty and then I may have a little, I don't know. I'm used to smelling fresh, 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 but not having the hormones like the estrogen, then, a lot has changed with my body. So I do use the deodorant, but I try to use the natural ones. But sometimes I realize that the natural ones will itch. Singing with Laura, hi, hello. So sometimes I realize that the natural ones will itch, and yeah, you stop using deodorant. Yeah. What do you use, Samantha White? You can share here. What do you use? I know they have the natural ones, but I don't. They're not working for me because they itch a lot. I think that's where this ovarian came from. Yeah. Hi, Nicole. Yeah. So yeah, the deodorant is one thing that we have to. Oh, you use nothing? Baking soda. I heard someone say that they use baking soda or powder, and even powder. I don't think powder is good because it has talcum in it. Yeah. I don't want to use anything either, but I feel like I just use a little bit. Like I don't paste it under my arm anymore. I just use a little tips under my arm. So yeah, that's what I do. It irritates my armpit. I get boils. Same thing with me too, Samantha. So yeah, it does irritate my armpit as well, and I get boils. So I don't use that anymore. I mean, I don't use the natural ones are the ones that irritates my arm. Okay. Yeah, so we have to be careful about what we use. Um, yeah. These topics are very important, I'm telling you. And I spend my time advocating for women. I'm very passionate about it because I know what it feels like when you're being diagnosed and you don't have any information. Or if I knew this or that, then I wouldn't eat this or I wouldn't eat that. Just, to have that risk reduction. Even what we put in our hair. Yeah, I'm afraid of even the makeup that we use. I'm afraid of the makeup, and I literally do my makeup every single morning, and I spray, and I'm like, man, God, go with me. I use the makeup every single day for work, every day, and I am worried about that too. The makeup that we use, what we use in our hair, everything, every single thing has some carcinogenic something in there. So we just have to, I mean, moderation is the key as well. Moderation. Hi, Katrina. I know you're from over Auntie Dana. Oh, hi. How are you? Yes, I was on. Yes, everything is bad, Martina. Everything is bad. Yes, I was on Auntie Dana's program. I think it was last week. Yeah. Thanks for tuning in, guys. I really appreciate it. Um, and I'm trying to use this platform to educate you guys, just to save lives. I don't want to see anyone being diagnosed. I fear it. It just reminds me of my situation all over, and then I start crying. Like, I don't know you, and I'll start crying if you tell me that you're being diagnosed. I feel really sad about it, and I just try to help. They have lots of lawsuits over here with most products for black women. That's true. Yeah, yeah, that's so true. Everything is bad. I mean, we just have to be vigilant with our body. Definitely. I'm 47 and I will be having my first exam. I do self-exam and I have yearly checkup. You motivated me from the interview. Oh my God, oh my God, this warms me. Like, I'm so happy that that's why I reached out to Auntie Donna, because I know that she have a big platform of women who needs to hear this information, and I'm so happy that if it's even one person, you know if it's even one, your story really touched me. Thank you so much. Thank you. I share my story even when I'm sick. I am out there just sharing my story. Yeah. But yeah, it's been pretty overwhelming, dealing with all the side effects of everything. It's quite overwhelming. So I just take it a day at a time and I try not to let anything bother me. I do a lot of writing. I love to write stories. Yeah, I do a lot of writing. I like family time. I like chill vibe. Yeah, yeah. It's true. May God continue to bless you. Thank you, Samantha. Really appreciate it. You know, God bless all of you all too. Um, it's not a one man's journey, and we have to be our brothers and sisters' keeper for sure. Have to, have to. It's so good being here this evening with you all, and I will see you guys tomorrow again at, let me see what time it is now. So I'll see you guys at 5:30 tomorrow and we can talk about something else. Yeah. Any other questions before I go? I'm not in my crown today. I'm not in my crown and my sash today. So I'm just getting in from work. Hi guys on TikTok. If you joined late, we were talking about breast cancer and risk factors. No smoking, no drinking, stay away from processed foods. Yeah. You're okay? Okay. You finish your homework? Okay. Yeah, guys. So no question. Let me check to see if there are any questions here on TikTok. I guess everyone is fine. I'm usually detailed. So most times when I'm finished talking, persons really don't have any questions. Alright, so I'll see you guys tomorrow at 5 o'clock. Your crown is automatic. Thank you so much. Thank you, thank you, thank you so much. Thank you guys for all the love and the support. Can't do it alone. Cannot. And I want you to spread the word about breast cancer and self-examination. Encourage persons to do their self-examination. Their arm, rub hair on the hair, rub the necks, as I say, feel for any little lumps, any lymph nodes anywhere in the armpit. Not just your breast, but check the armpit for any lumps. Because sometimes that's the first place that it spreads to, the armpit. So you really want to check that area as well. As I said before, I had 14 out of 17 positive lymph nodes. So you really want to do some checks right there. Yeah, you really want to self-check. And if you feel anything, advocate for yourself, because sometimes the doctors will tell you that you're too young for any mammograms, you're too young for anything. Tell them no. You want to do your mammogram, you want to do your ultrasound, you want to make sure that nothing is there. So advocate for yourself. And if you're not sure, listen to your body, get a second opinion. Definitely a second opinion. Yeah. I lost several friends. Like after today, I got a call. A next person from a group that I'm a part of, she died today from breast cancer. She had it and she went in remission, and then it came back. She was on treatments. She started some herbal treatments as well, and it was working. There weren't any sign of, I mean, she had like a complete spread, but when she started the herbal treatments, all the there wasn't any sign of cancer, maybe just in one place, and she was so excited. It went from her bones and no sign of cancer. And then she got really sick and she died today. You know, such a sad situation. I've seen so many, like last year, this time I lost my friend to breast cancer as well. If your story, I make every time I check. Yes, make sure you take the time out to check. It's your life. Take the time out to check your breast, definitely. So, yeah. Last year I lost two. This year so far maybe another two. I mean, and I have a couple of friends. They're in their 30s too, and they're fighting breast cancer. That spread to the brain, to the bones. It is crazy. It is, and it is frightening, and it sometimes I'm afraid too, and which is one of the reasons why I opted to do the next breast, because I was afraid. But we just have to pray and trust in God and do what we can do on our end. And as I say, we cannot do it alone, and with the strength of God, I know we can do it, because there were several times when I was on my journey and I cried. I cried several days. I cried, and I had anxiety and panic and thinking that I was gonna die. But let me tell you something. I tell people all the time, God is the answer. He is the answer. And I am telling everyone, just trust in God, pray, listen to positive, anything positive. You know, you can listen to Joel Austin on YouTube as well. CC Winans, you listen to your song, you pray, you believe, and just leave everything to God, and He will take care. And always be good, do good to everyone, because trust me, it will come right back around. I encourage everyone to just do good, because it will come back around. Just have this calm, free spirit in life, you know. Just be calm, free, no arguments. Just let things flow. Just let it flow. So those are some tips that I have, and that's the type of person that I am today. I was never a warmonger or anything like that, but I think I am more calm now than before. I mean, even though I'm going through menopause, you see I'm sweating. I have the hot flashes right now. But yeah, apart from that, I'm a humble soul, and it gives me a great peace of mind. Yeah. I love you guys. Thanks for tuning in, and we will talk again tomorrow. Bye, guys. Remember to self-check tonight when you're in the shower, especially when you're soapy. That's the best time to check. Take care, guys. All the best. Bye.